Neck pain. In this video, we're going to talk about neck pain from chiropractic point of view, meaning mostly musculoskeletal. Usually, neck pain mostly starts from muscle strain, sprain or strain. We have large muscle around the neck in front and back. Some of them, they help you to rotate your neck. Some of them help you elevate your shoulder. Some of them, they help you to rotate your shoulder. And you know, neck muscle and shoulder muscle, they go hand in hand together. So later on, we're going to tell you why that is important. Now, if we take all the large muscle out, all of them out, and we go to the next to the vertebra, we will see between each vertebra there are muscle, we call them paravertebral muscle. These are the muscles that are responsible for fine movement of our neck, the way we tilt our neck to the side or rotate in very smooth. That's why we don't look like robots when we move. And those are very important muscles. Now, there are other muscles that between them, artery and vein, they travel, and when those get into stress, they could interfere with our circulation. Nevertheless, most of the problem with muscle start with muscle spasm. Now, let's see what is muscle spasm. Muscle spasm is involuntary contraction of the muscle. In other words, muscle that contract and it does not relax. Let's give few examples. For example, when you go to a dentist and you are doing a root canal or something and your neck is tilted for a long time, even after you leave the dentist's office, you still feel like your neck is tilted. Or when you are on the phone at the same time, you are on a computer and you've been on the phone for a couple of hours, even though you put the phone down, you still feel the neck muscle or even shoulder still is irritated. Or when we go to the gym, you know, when we weight lift or when we do push-ups and we grab our neck and we pull it and we push a little too hard, and those, believe it or not, could create neck injuries. A lot of my practice consists of people who hurt themselves in the gym. Now imagine also when you travel, you put the one bag over your shoulder and another luggage you pull. And remember we talk about neck muscle and shoulder muscle, they work hand in hand together. And when basically we carry luggage for a long time and pull it, although we hurt our shoulder, we could hurt our neck as well. Another thing could create one muscle spasm, very few people know about it. When we expose our neck to cold, believe it or not, cold could create muscle spasm. Or when we go on a plane and we fell asleep on the plane, we tilt our head when we fell asleep, and after like 4 or 5 hours, we wake up and we wonder why our neck is in such a pain or is stiff, because while we are flying, we are stressed out, and that could create muscle spasm. Or when we sleep and the pillow is too high and we fight with pillow all night and we press against it. In the morning we wake up and we know our neck is stiff. Or we spend a long time, 8-9 hours on a computer without knowing it, in a hump position, and then we getting up, we see back of our head and back of our back is very stiff. Or just we are emotionally, we are very emotional. Believe it or not, emotion can give you neck spasm. Now, why that neck spasm is so important? You know, if neck muscle gets spasm, it doesn't let the vertebra to move. And that creates another condition we call joint restriction. Now, what is joint restriction? Imagine I put your finger in a cast for 3 months, and I tell you you have to keep it in a cast for 3 months. And after I remove the cast, do you think you still can bend your finger? No. Why not? Because your joint didn't move for about 3 months. So when our muscle goes to spasm, it doesn't let our vertebra to move. All those joints in our neck don't move because of the spasm, and that's create neck pain. And then we call something like that, we create a joint stress. Now, usually spasm doesn't happen evenly. So in other words, one side is spasm one way, another side it doesn't. So uneven joint stress could create something we call in chiropractic is misalignment. And misalignment itself could have consequences. Now, Joint stress itself could create problem like degenerating the disc that is between the vertebra in our joints. Now, when the joint is normal, is fine, the height of the disc is high, nice and high. But the moment the disc the joint doesn't move, the very first thing to go, the disc height start to diminish, and we will have degenerative joint disease. And after that, if we keep still ignoring it, the disc become bulge disc, and right after that becomes herniated disc, and eventually the disc will disappear and the joint will fuse. Now that itself, it aggravates the pain even more and becomes chronic neck pain and creates some other condition we call nerve compression. Now there's two ways we can compress nerve. Now through joint stress, or remember the muscle we talked about, paravertebral muscles. Those muscles, when they go to spasm, immediately could create pressure or interference with the nerve. In chiropractic community, we call that system is subluxation. In other words, when the vertebra misaligns and puts pressure on the nerve. Now, when we have a nerve in the neck, when we have an irritated nerve in the neck, usually the pain radiates into our shoulder, and by the time it gets worse and worse, it radiates into our arm, even our fingers. Now there are 8 nerves in our neck, 8 cervical neck, that any of them could go through this, from right below our occiput, our head, all the way to our shoulder. So this nerve, they could give us the nerve compression problem. Now there are other issues that could create all this altogether, like injuries, like whiplash. Whiplash is very common in my practice. People be in car accident. But another thing could cause neck pain, which is disease or infection, which is out of the scope of this practice. Now, what can we do about all this issue that could happen in you? If the problem is still soft tissue or muscle problem, the very first thing we do, we want to relax that muscle. And in our office, we do something called electric steam or physiotherapy modality. That's one of the very common thing in chiropractic offices is done, electric therapy. It feels like massage through electric therapy. It's very soft and is actually pleasant. Another thing we could do is basically give you manupular therapy, gentle stretch on the muscle, try to open it up, or literally gently massage those muscles, try to get them to relax. Or there are other physiotherapy modalities such as ultrasound. Now, focus ultrasound is very effective to relax the shoulder and neck muscle. Sometimes in advanced cases, we do ultrasound therapy. Or in case of joint stress, when the joints start to lose the joint height, what we do mechanical traction. It's a machine we put you in our office that basically start to pulls on your neck very gently and relaxes every 10 seconds. So your body do not adapt to the traction. And believe it or not, is super effective on a joint stress and when the joint height start to diminish. But when the joint is misaligned, the best way chiropractic could deal with that is chiropractic alignment or chiropractic adjustment. So thank you for watching this video presentation. And if you have any question, please call us. And please come to our offices for free exam. Have a great and healthy day.